Get started. During the course of the pandemic, we have learned more about COVID-19 and its long-term effects. For some patients, the side effects can actually be slow to leave the body. They're called long haulers, and they're patients who fight the virus for an extended period of time. So here to talk about it is Dr. Dilpreet Kaur, who is a pulmonologist at Windham Hospital. Is there any data about the numbers of long haulers in Connecticut? What do we know about them?
So there is no exact number of long haulers in Connecticut. We do have studies. The last one came out a few weeks ago from University of Washington that states that about 30% of people who got COVID still have symptoms 6 months after. So there are approximately 300,000 people in Connecticut, positive. So if you calculate, it's around 90,000 people who might have the persistent symptoms, have what's called COVID long hauler. There's a new name for it. I just wanted to bring it forward. I'm sure it's been on the news by Dr. Fauci. It's called post-acute sequelae of SARS-CoV-2, PASC or PASC. So, there's a huge number, about 90,000 to 100,000, I would expect.
What kind of symptoms are they still dealing with?
So there's a whole list of symptoms, but weakness, fatigue is up there. That's what most of the people experience. And then there are pulmonary symptoms that I deal with: shortness of breath, chest tightness, chest pain, cough. There are cardiology symptoms, cardiac symptoms like arrhythmias. That's not common though. And then there are GI symptoms like diarrhea. Last but not the least, neurological symptoms: brain fog, memory loss, depression, anxiety, even PTSD-like symptoms. So there are quite a few symptoms: loss of taste, loss of smells out there too.
As a pulmonologist, are you seeing long haulers, and how are you treating them?
Yeah, I'm seeing quite a few long haulers. I was seeing them before COVID Recovery Center opened with Hartford Healthcare, but I'm seeing a lot more after the COVID Recovery Center was started in October last year. I see 1 to 2 patients every day, and most of them are still short of breath. A part of it is excessive weakness, chest tightness, cough. And we have to make sure that there's nothing big organ damage causing the symptoms. So, we start with doing CT scans, lung function test, start with, 6-minute walk test to see if they need oxygen. And if there is something organ damage that we notice, we treat that. If not, we have a lot of other options like medications, like inhalers. We can do physical therapy, rehab. So those are the things which we're using here.
If someone has been suffering from symptoms, when is the right time to contact the COVID Recovery Center?
So I would say even like 3 to 4 weeks after you're positive and you're noting that it's not going away, your symptoms are not getting better, they're just staying or getting worse, I would recommend to call, because, we have to make sure there's nothing serious going on. It's not just, for people who are suffering for months and months. I feel like we can help people with COVID long hauler symptoms, and the sooner we see you, the sooner we can help.
And we're certainly grateful to Hartford Healthcare for helping us to understand this virus better. For more information about COVID long haulers, visit hartfordhealthcare.org/COVID recovery.